everyone, I'm Dr. Lindsey Tubaugh. I am the co-founder of Little Heroes Pediatric Hearing Clinic in Layton, Utah. I'm an audiologist that specializes in pediatric hearing loss, in hyperacusis, misophonia, and tinnitus in both children and adults. And what that means is that I really work with a lot of people who have sound sensitivities. One of the populations that tend to have a high amount of sensitivity to sound is people who have autism. So I decided for today's video to interview someone that I know who works very closely with people with autism so that we could get her take on that. And then I'll be doing a part 2 video where you can learn a little bit more about what I do as an audiologist to help with this sound sensitivity and things that you can also do at home for your children or for yourself if you're an adult suffering with this. Hey everyone, I'm here with Alexa Archibald, and I'm gonna actually let her go ahead and introduce herself and her specialty and what she does.
Yeah, so I was an RBT for like 4 years. So that's a registered behavior technician. They work directly with kids one-on-one doing applied behavior analysis or ABA therapy, as a lot of people know. That as I did in-home therapy, I also ran social groups for kids with autism to help with their social skills. And now I work in a private school for kids with ASD as a behavior analyst. I have my master's degree in ABA and special education, and it's just like a huge passion of mine. So it is my whole life.
I know it is. And every time you talk about it, when I'm in person with you, like your eyes just light up. And I just know that like you're just such an incredible force for good in this community. So I'm super excited to hear what you have to say. So I was reading, I know you know the research a lot better than I do, but before this, I was reading a study that said that approximately 60 to 65% of people with autism have sound sensitivities. Does that sound about right to you?
Yeah, so they all have sensitivities in some areas, right? Either like hypersensitivity or hyposensitivity, where it's like under responsive with all of their senses. But yeah, a lot of them have sound sensitivity. A lot of the kids I work with, we help through some of those sound sensitivities. Some of the studies I was looking at before this, and I know we'll get more into this, but it said around like 40% of kids have hyperacusis that's undiagnosed because they just assume it's part of that sensitivity. And then 18% of those with ASD are diagnosed with it. So.
Yeah. And that's something, so that's one of my specialties is hyperacusis. And that is something that we diagnose here in my clinic as well. So that's definitely something that I'll be talking about in part 2 of this video. But yeah, it's definitely something that I hear a lot from parents who call in or come to the clinic to try to get that as a diagnosis, or even misophonia, which is an actual hatred of certain sounds. So where hyperacusis is like, somebody who doesn't have hyperacusis can hear a medium to loud-ish sound and be able to cope okay, but somebody with diagnosed hyperacusis would be somebody that it's just super, super sensitive to that sound. Misophonia, I've also seen children with autism with misophonia, and they can have both, where it's a very specific sound that kind of triggers them.
Yeah. I've seen both, a lot of both. So so a lot of these kiddos, it can manifest in a lot of different ways, just because the famous saying in ABA is like, once you've met one person with autism, you've only met one person with autism.
Sure. I like that saying.
Hence the spectrum, right? It looks different for every single person, but there's a lot of like key things you can look for in order to understand that there might be some, auditory thing going on. Most little kids will cover their ears. They'll like push them in multiple times. I've seen kids who will just like lay on the ground and cover their ears. Sometimes they'll scream, sometimes they'll cry. That kind of comes with the emotional response to it as well. I've had other kids that will pull their shirt over their head as tight as they can, just trying not to hear things. Or even some kids will just make louder noises to try and drown out the noise they don't want to hear. So some parents will think it's some type of verbal thing or some stimming when they're just yelling like that, but they're actually trying to cover the noise they don't want to hear, or the ringing in their ears, or whatever it might be.
Yeah, as an audiologist, that makes perfect sense. But I think that those are good things for parents or teachers to kind of watch out for and,
Yeah.
know. So what are some of the things? I know I had reached out to you in the past regarding a specific patient, but what are some of the things that you guys do or that you recommend parents do to help when they can tell that their child or if they themselves have a sensitivity?
Yeah. I wrote a little list to start off. Some things that like the parents can do first and then gradually go into more like in-depth, I guess, things.
That's great.
So the first thing, I feel like as parents, you know your kids best, right? You're going to be able to know when something's off, whether they're doing the things we just talked about or something just seems weird with their hearing. So the first thing to do is to reach out to like an audiologist, something like that, and get to know the type of sensitivity that you might be dealing with. There's a bunch of different ones. You've mentioned a few, and I'm sure you'll cover more, but you want to know the type of sensitivity so you'll know how to tackle it better, I would say, is number one. The next one is just to find a way to provide at least that temporary relief. A lot of the kids I work with have noise canceling headphones or earplugs that we've taught them just to go grab when there's a noise that's bothering them and put them on so that they can still focus and do their work or whatever it might be. This isn't like a permanent solution, but it does help them. And when they get into situations they've never been in before or louder situations, whatever it might be, they know to go grab those and have that temporary relief. Is always good. Makes the parents feel better too, because then they're having a little bit of relief. Another great thing that I would suggest, and I do with some of my clients, is find and show them a safe environment or a quiet environment where they can go. So we have like certain rooms in our clinic that will just like, there's nothing else in there and they can just go sit in the dark and in the silence if they want. Or we have like this tent swing that they can just go sit in and it's silent, because they just need that safe, quiet environment to help them kind of reset and recoup.
Yeah. And I think that makes a lot of, like, I think we all kind of need that, but especially people who have anybody that has this hypersensitivity to stimuli, whether it be visual or auditory, like having a place to go to feel like they're safe, I think can be super important.
Yes, it's always good. I do it too. At the end of a work day, I'll just like go sit in my car for like 5 minutes in complete silence before I drive away. It's just like, you need that,
Yeah, I think most of us can relate.
Yes.
I can relate.
So just showing them and having like a safe, quiet environment that they know that they can go to if they're feeling overstimulated.
Yeah.
It's really good. Really with any sensitivity, but hearing too. Another one that I thought of was just allowing them to feel control over some of the noises that they might hear. We all want to feel some sort of control, right, in things. And so to help cope with that anxiety that might come along with the hearing or any of the other sensitivity disorder, whatever it might be, you want to give them control. So some ways to do this is like, if you know they don't like the sound of a bell, show them different types. Show them the musical bells, show them a doorbell, show them the bell that you'll see at reception office. Let them play with them, let them experiment with it so that they feel like sometimes they have control over it and it's not as petrifying when they hear the bell.
Sure. Oh, I like that. That's a good idea.
Another easy one is allow for distractions to happen. I know sometimes you just want to like talk them through the sound, but that doesn't always work, especially if there's trauma connected to it or whatever it might be. So allowing the distractions, having something that you know they really love and be able to provide that when you know the sound is going to occur. So it's not as hard for them.
Yeah, and I'm sorry if this is something that you were about to say, but one piece of advice you had given me one time that I really loved when I saw a little one who had both misophonia, the hatred of very specific sounds, even when they were quiet, and hyperacusis, which is just kind of a more global sensitivity to louder sounds, was to give her a choice. So mom and I came up with, okay, we know that this is a sound that she doesn't like. So whenever the sound happens in the home, we're going to be ready with a couple of choices. Okay, so do you want to do this or do you want to do this? And it kind of maybe played a little bit into that control, maybe not in the same way that you were talking about, but gave her some control of, okay, I want to do that, and I thought that was a really good piece of advice and was very helpful to the mom that I was working with as well.
Yes, I have learned that giving them choices it's magical, is what I tell the RBTs that I'm training. It's like they love choices and they're way more willing. I think everybody is, right? When you feel like you have a choice in the matter. So it's
Absolutely.
a great antecedent strategy to use for really anything. So yeah. Let's see what else. Another one is alternating noisy and quiet times, right? So that they're getting that exposure, but they also are not getting overexposed and overwhelmed by the noises. So just having like a routine where they're exposed to both noise and quiet throughout the day can kind of help them get used to it. And then, so those are just some things I listed that you could like do at home as parents, whatever that may be, or like caregivers. Some other things that I would suggest, if the kid is in, and I'm speaking for kids in general because that's my experience, but this could apply to like teens or adults or whatever, is talk to their BCBA if they are in ABA therapy, because we're able to provide a lot of treatment plans and goals for them to get them used to those noise and increase their tolerance of those as well, until it either becomes like a neutral or even a positive noise for them. We can work behaviorally to do that. And then you can kind of get into the more like therapy treatments for them. So auditory integration therapy is a big one that you'll hear about for kids with noise sensitivity and autism. I do have to give a disclaimer as a professional that it's not an evidence-based practice yet. It's been shown in like, I think it was like over 23 research studies that there is significant evidence that it works. It's just not evidence-based yet.
And can you explain exactly what that type of treatment entails?
Yeah, so this awesome integration training or therapy, you'll hear it both ways, ATI, is basically a type of sound therapy. So what they'll do is like try to reduce the sensitivity to certain sounds that might bother whoever it is they're working with. So what they do is they'll attend like 2 30-minute training sessions, and they'll put on headphones or whatever it might be, and they'll play music where they have removed certain sounds or pitches to it, and then they the specialist will like control the volume very carefully, and it eventually gets them more desensitized to like higher pitched noises and the lower range noises as well. And I think it goes on for like 10 or 12 days, and then they reassess how they're doing after that. So and then they do the same thing with like different sounds too. I think they usually start with music and then they'll go into more challenging sounds that are like very high or low frequency, just to get them more used to hearing the sound. So
and I think one thing that's very clear is there does need to be a lot more research into this. These types of therapies, but just sound sensitivity in this population in general. It seems like there's, even in the recent research articles that I've read, that was kind of the conclusion, is that, we're still working on this, we're still learning about it. And, sound therapy is definitely something that we do here. And it sounds somewhat similar in that the worst thing that you can do generally with any person that has a sound sensitivity is take the sound like sounds away, because it can actually make your sound sensitivities worse. And I think that's where we've seen a lot more people get away from this constant wearing of headphones, or sound protection, where they're not getting any stimulation, because we want to still stimulate those auditory areas of the brain, because otherwise, it creates more of a problem than when you started. But I do like I am very supportive of people using some kind of headphone, especially if can have some sound streaming, like even white noise or pink noise streaming in addition. But as sort of this emergency, like I need something, and using it, here and there, I think is healthy for everyone involved, but just not as like a general, my child's going to wear headphones all the time that just block out.
Right. Yes.
As much
You
as
definitely
possible.
don't want them wearing them all the time. Yeah.
Yeah.
But like one example, we have a kiddo at my clinic that will scream very high pitched constantly. And there is another kid in there that has a lot of sensitivity to sound, and normal voices already seem very loud to them. And so for him, he'll go grab those. When the other kid is screaming, he'll wear them. He'll wait till the screaming stops, then he puts them away. Which is super awesome. It took him a minute
he
to
knows
get there, but it's awesome that he can do that himself.
He knows what to do to help himself. Well, perfect. Okay, is there anything else you'd like to add?
The last one I read about, you might know more about this than I do, but it's the TRT, which is like listening to pink noise. That has had a lot more medical research, what I've read, than the AIT therapy. So a lot of people opt for that since it is more research, but that one's basically like pink noise, right?
So it's actually very similar. It's not that different from kind of what you were talking about. And TRT stands for tinnitus retraining therapy. I'm pretty sure that's what it stands for. Yes. I should know this. I do know this.
Right. I know, you forget what things are called.
But so this is something where we're trying to pair like a negative, not pair a negative thing with a positive thing, but also kind of like we're trying to just give some soothing sound, because what we definitely don't want to do is take away auditory stimuli, because that can increase the sensitivities, as we have already stated. So what we can do is introduce pink noise or white noise, either in the environment through hearing aids or headphones, but where they're still hearing the sounds around them, but they're getting a little bit more positive stimuli. I think of it like, and then you kind of increase or decrease the sound so that they increase their ability to habituate or to kind of get used to those offending sounds, so to speak. So basically, we just want to introduce a sound where they're still getting awareness around them. But the idea is kind of like if you go into a really dark room and you turn on a flashlight, the flashlight's really bright. And that's similar to like sometimes around our world, if it's very quiet, and then there's this really offending sound, it can create more of a reaction than if there's like a calming noise that's going on around you, and then the offending sound comes. It's not quite as bad, kind of like in the room. If you have your light turned on and you turn on your flashlight, you might still see the flashlight, but it's not so bright. And so I'm not sure if that's a super great example of TRT, but kind of similar to how we use sound to help retrain the brain to be able to cope with sounds a little bit better. So
rebuild the tolerance
that
your brain has for the sound.
Exactly. Yep, exactly. All those neural pathways. And we know a lot about neuroplasticity and how the brain can really learn how to cope with these sensitivities. That's really what we work with. It sounds like on your end, as far as audiology end, in creating these neural pathways to help a person cope better with what they're sensitive to. Yeah. Okay, great. Well, I think that was great. If there's nothing else you want to add, then Okay, great.
I don't think so. Yeah.
So thank you so much to Alexa Archibald for joining for today's video and for all of her insights. She does incredible things with children every day. And I know she's going to continue to go on to do incredible things. And so thank you, Alexa, for joining us.
Yes,
And
thank you.
you're welcome. And for everybody else, there will be a second part to this video where I go into a little bit more detail about what I do as an audiologist for those with sound sensitivities. For this population as well, because it can be sometimes a little bit different, modified. And like Alexa said, each person is different. And so it definitely takes a different approach with every person that we see. And so, but in general, we could talk about the things that we do to help those with sound sensitivities. So Alexa, thank you again so much. I just really enjoy our conversations and I hope to see you soon.
Awesome.
Okay.
Thank you so much.
Bye,
Bye.
everyone.